So I will get going on the usual remote conduct for open meeting spiel before we jump into the various topics. So welcome to the February 8th, 2021 Grafton Board of Health meeting. As a preliminary matter, this is Karen Gwozdowski-Govin, Chair of the Board of Health. Permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Dan Finn.
Dan Finn here.
Austin Magnet. Dr. Muller. Oh, you're on mute.
Sorry, Bill Muller here.
And then Josh Briggs, I know, had sent a message that he wouldn't be able to make it this evening. Staff and anticipated speakers on the agenda, when I call your name, please respond in the affirmative. Nancy Connors. Looks like it says she's connecting to audio still. She was having some issues. Julie Van Arsdalen.
Present.
Danielle Edmonds. Carter Terenzini.
Present.
William Blake.
Present.
Barbara Conley.
Present.
And Ray Mead was a potential also. And then Austin, I see that you just joined us now, so welcome.
Hey guys, Magnet's present.
All right, so I'd like to open the meeting. Can I get a motion to open the meeting? And as a reminder, state your name when making a motion or a second.
This is Dan Finn. I'd like to make a motion to open this meeting.
This is Austin Magnet. I'll second that motion to open the meeting.
All right, and then all in favor with the normal roll call vote. Dan Finn.
Dan Finn, aye.
Austin Magnet.
Austin Magnet, aye.
Bill Muller.
Bill Muller, aye.
Karen Gwozdowski-Govin, aye. So good evening again. This open meeting of the Grafton Board of Health is being conducted remotely, consistent with Governor Baker's executive order of March 12th of 2020 due to the current state of emergency in the Commonwealth due to the outbreak of the COVID-19 virus. In order to mitigate the transmission of the COVID-19 virus, we've been advised and directed by the Commonwealth to suspend public gatherings, and as such, the governor's order suspends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed and encouraged to participate remotely. The order, which you can find posted to the town's website at www.grafton-mass.gov, allows public bodies to meet entirely remotely as long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. There are no public hearings scheduled for this evening's meeting. For this meeting, the Grafton Board of Health is convening by video conference via Zoom, as posted on the town's website identifying how the public may join. Please note that this meeting is being recorded and that some attendees are participating by video conference. Accordingly, please be aware that other folks may be able to see you and that you take care not to screen share your computer. As you're aware, anything that you broadcast could be captured by the recording. Any supporting materials have been provided to the members of the body, available on the town's website unless otherwise noted. The public is encouraged to follow along using the posted agenda unless I note otherwise. We will be turning to the first item on the agenda in a moment, but before we do so, permit me just to cover some basic ground rules for effective and clear conduct of our business and to ensure accurate meeting minutes. I'll introduce any speakers on the agenda. After any remarks are concluded from said speaker, I will ask if any board members have any questions, comments, and then if none, then we will obviously move on. A couple general reminders: please mute your phone or your computer while you're not speaking. And then please remember to speak clearly and in a way that helps generate accurate minutes. For any response, please wait until I, the chair, yields the floor to you and then state your name before speaking. If members wish to engage with other members, please do so through myself, the chair, taking care to identify yourself. And then finally, any votes taken during this meeting will be conducted by a roll call vote. So with that, the first topic on the agenda is the Alliance update. Julie?
Do you want me to tell you about the changes to the sector-specific capacity limits?
Sure.
Okay,
Safety
so
from going over them.
Okay, so effective this morning at 5 a.m., the governor is now lifting the 25% capacity on businesses such as arcades, driving school, flight schools, gyms, libraries, museums, retail, office, place of worship, lodging, golf, movie theaters. And movie theaters can have no more than 50 per theater. Restaurants are now are limited to 40% of their seating capacity. The employees don't count in that total. Close contact personal services are now limited to a 40% capacity. A limit of 5 people per 1,000 square feet applies to smaller businesses without an available fire occupancy capacity. Gathering orders. The gathering orders will stay at 10 indoors and 25 for outdoors. And the Commonwealth still remains in phase 3, step 1 of the reopening, order number 58. Indoor performance venues and indoor recreational businesses like roller rinks and trampoline parks are to remain closed. All changes took effect this morning at 5 a.m. Also, I just wanted to touch a little bit about there's a Zoom meeting scheduled for Wednesday. I believe it's between 2 and 2:45 with the Worcester City Manager. And it's encouraged that the board members call in or attend, as well as the town manager and Nancy. So I just wanted to let you know and just remind you about that. It's a very important call. And it's
Call
regarding,
again? When was that call?
it is on Wednesday between 2 and 2:45. And an invite was sent to, I believe, town managers and to admins in the Alliance communities.
Yeah, Nancy forwarded to the board members.
Okay, yep. So that's something I just wanted to talk about briefly.
All right. Anything else, Julie? Or I know typically it's always just COVID stuff at this point.
Yeah, it's COVID stuff, but also I don't know if you'd like me to give, I don't know if you had the opportunity to read Danielle's inspections that she completed. I don't know if anybody received the list.
I think so. There's been so many.
Okay, so I'll just tell you, I'll briefly touch on them. So the inspections she conducted were the following: Stop and Shop, Wands, Jen's Frosted Cakery, which is a residential kitchen, Reunion Tap and Table, Village Dairy, Cumberland Farms on Worcester Street, Grafton Inn, Pepperoni Express, Lakeview House of Pizza, and CVS. And then she had a complaint at a local establishment about guests not wearing masks. She did make a site visit there, as well as a complaint at a retail store, lack of mask wearing as well. And she did a site visit on February 3rd. The complaint there was founded, and Danielle provided education and a verbal warning to the employees. I know that Dan asked if she was going to make a second site visit. I'm strongly going to encourage her to make another site visit. And then from there, written warning and then a fine would be handed out. And I don't know if anybody has any questions regarding any of the establishments.
Dan?
Thank you, Karen. Julie or
Yes.
Nancy, you too, it's a little early, but were there any complaints about Super Bowl parties today that happened yesterday? Either businesses or homes?
Not that I'm aware of.
And
In any Alliance community, I don't believe there's any.
That's good.
yeah, Nancy's trying to get, for some reason, she can't get her audio to unmute her. So
Yeah.
playing tech support as we speak. I haven't heard of any. So I'm assuming if I haven't heard of any, Julie didn't hear of any, then most likely I would assume Nancy hasn't heard of any either.
Right.
it may have been different if the Patriots were playing, I suppose. And but I think there was pretty good viewership locally anyway.
All right. There's any other questions for Julie, the board members? No. All right. Well, thank you, Julie.
Okay.
All right. So next topic is under discussion, COVID-19 updates. I'll start off with the usual. As of February 8th today, Grafton's been informed of a total of 927 confirmed positive COVID-19 cases. As of February 4th, Grafton is actually down to a yellow status this past week. And we're seeing a similar, we'll call it, level of cases continuing in surrounding communities in the Commonwealth. It seems, and I don't want to jinx anything, obviously, that the surge we had been seeing post the holidays may be starting to taper down some. So I really hope that there were no major Super Bowl gatherings, because I know there were concerns across the Commonwealth and the country that Super Bowl gatherings could then in turn lead to almost like a smaller surge, potentially similar to what we saw after the holidays, but probably to a lesser extent. That being said, even though the daily case counts seem to be getting lower, they are not disappearing by any stretch. And as we all know, COVID is still out there and will be with us for a long time. So everyone still needs to remain vigilant, mask wearing, social distancing, complying with the governor's orders, gathering limits, et cetera, because it's going to be some time before the vaccine has gotten to the point of where it needs to be in the population from any type of hopes for, say, a herd immunity, for example. So we have, unfortunately, a good amount of time to go with this. Julie already covered where we are from a Commonwealth restriction level, so I'm not going to go back over that again. Carter, the next thing I had was around the potential way to handle now that we've seen us go down to yellow, and there's always the unknown, are we going to stay yellow, go down to green, potentially go back up to red, because there's no way of knowing and predicting what our color status will be and how that will impact the opening of the municipal center for potential public appointments again. I know you wanted to talk about what the board thought potentially is the best way to manage that go forward.
Yeah, thank you. What I'd like to try to do is to put something in place so that when these changes happen, it's understood ahead of time of what the reaction is going to be, so that we're not reacting in the moment. My thought is that when we are green, and that will come, we reopen to the general public. When we are yellow, we go on the appointment only basis for about half a day, in part because we have to have somebody at the front desk tracking people. And so we don't have the funds to put somebody there for 8 hours a day. And that when we go to red, we shut down to the general public as we did this past time. My thought is that given, I'm going to assume for the moment that these determinations will continue to be issued on Thursday. So if we go up in level from green to yellow or from yellow to red, we would do what we did last time, which is on Monday, which gives us Friday to deal with people who had appointments coming in that day. It allows us a couple days to get the news out that we would change. So we would become more restrictive. We go from green to yellow, yellow to red. But in coming down, we would be a little bit more cautious and not reopen for at least a week after the determination had been made. So in coming from red down to yellow, we made the decision that we weren't going to reopen. That was last Thursday. What would that have been, the 4th perhaps?
Yes, yeah, it was the 4th.
We made the decision that we weren't going to reopen till the 15th, so that we had one more week of data. And I don't think this would change with just a week of data, but we want to make sure it's not a fluke before we reopen. So that's our thought, and we'd like to get the board's reaction and comment so we can adjust that and formalize this in the next day or two.
Board members, anyone?
I
Dan?
think that's a great idea.
Yeah, yeah, Carter, this is Dan. So would it be a 1 week or a 2 week wait, or a week and a half, I guess?
It'd be about 10 days. So
Right.
the news is released Thursday night, 7:30, 8-ish, 9-ish, somewhere in there.
It
It's,
depends. Sometimes it's actually 5 o'clock, sometimes
Yep.
it'll.
but you're in the post business period. We might not know until the next morning. And so we would wait until the following Monday. So in this instance, we heard the news on the 4th. Today's the 8th. We would wait that additional week until the 15th. Now, in this case, happens to be a holiday. But the thought is to just go through one cycle, just in case, for some reason, it was a fluke and we have a flare up. Now, I don't think that's likely to happen. But I just think it would be prudent to wait that extra week.
Karen,
Yes, Doc.
I think that would be fine. There has been some discussion about whether the governor is going a little bit too fast. And I think obviously it would be easier to extend a week than it would be to kind of revoke something that just had been decided. So I think it remains to be seen. I don't know whether the Super Bowl will have any effect. Certainly, we're past the holidays, and so that's good. And the days are getting longer, and perhaps soon a little bit warmer. So hopefully, this will be a sustainable trend. But I do think what you're suggesting is a reasonable way to approach it.
I agree. Barbara?
I have a question.
Yeah.
So, Carter, when you said the building would open when it's green, since we are part of the municipal center, the senior center, would that also open if we should have the green status?
That would be my intent.
Okay.
The building and all the activities therein would be open as they had been pre-COVID.
Okay.
If for some reason the definition of what constitutes green changes, and there's concerns about that, I would leave that to the incoming TA to revisit. But yeah, that would be my intent, Barbara.
Okay. Because we would have then would be served in, so there would be meals served in. So I just was wondering if there would be like some type of specific.
Yeah, I would view green status as essentially being pre-COVID.
Okay. Perfect. Thank you.
Any other comments from the board members?
Again, this can be revisited. I just think that having something reduced
yeah.
in writing, so there's a guide, so it isn't being made up every time there's a bump in the road, would be useful to the employees to know what the reaction would be, and to the general citizenry. So we'll write this up in the next couple of days then and circulate it and make sure the Board of Health gets a copy, Karen.
All right. Perfect. Nope, Dan?
Aaron, yeah, that's why I was going to suggest, I don't think we need to vote on this. I think, Carter, you have a consensus that it sounds like a reasonably safe approach, and that we may have to tweak it, as you said, as we go along a few weeks or a month from now, but sounds like a good plan to me at this time.
Yeah, when I write it up, it will refer to a consensus of the Board of Health. We don't need a formal vote, just consultation with you is sufficient for me.
Great.
All right. Thank you. So that's all I had for like pure COVID updates without getting into the next topic of vaccines. Is there anything else any board members want to talk about related to COVID outside of vaccine updates or anything else that's already been covered? I will take that as a no. All right, so vaccine updates. This is related to phase 1 and phase 2, specifically right now, just the first part of phase 2, which is the 75-plus-year-old individuals. I'll at least kick off the topic and go through what's known and some of the general unknown before we get into maybe some more specifics. So I will say that vaccination locations continue to offer appointments to individuals in phase 1. So just because phase 2 has started to open up to the first subgroup doesn't mean that if someone didn't get their vaccine as part of the original phase 1 rollout, and they're eligible under phase 1, of course, that they can't get that. It just means that they're continuing at the Commonwealth level to expand access. So by all means, if someone is in phase 1 and wants to get a vaccine, do seek out the locations that are available and via the resources that are out there. So I just wanted to call that out because I did actually have someone ask me if like phase 1 got shut off almost, for lack of a better term. So I just figured I would call that out where that question did come up. I will say that the Commonwealth's announcement that phase 2, the first part of it, was starting on February 1st, did catch a whole group of us by surprise in the more local community area. Because a couple days prior to that, the estimate to start phase 2 was actually late February at the earliest. And there's obviously concerns across the Commonwealth and the whole country that access to vaccine is still very limited. So a lot of people were expecting that kind of late February to actually be the earliest possible. And then obviously, as we all know, it got pretty much chopped off by a month. So as we've also all seen, there's been some hiccups along the way with how the Commonwealth's vaccine locator website has rolled out and the access available and the ability to use it in a, we'll call it, easy fashion. It's been deemed not user-friendly, especially considering the first part of phase 2 is the 75-plus population. The Commonwealth did announce recently that after all of these concerns were voiced, that there will be a hotline. It'll be 211, that individuals who are eligible or family members of the individuals who are eligible can call for assistance for making appointments if they're unable to utilize the website. So that was good to see that the Commonwealth was coming out with that extra, we'll call it, resource, and not just leaving it up to people to try to navigate their website. The Worcester Alliance EDS Supersite continues to vaccinate individuals from the Alliance communities, Grafton is one of those, that are eligible per the Massachusetts phased approach, which is, as I mentioned, all of phase 1 at this point and the first part of phase 2 for the 75-plus individuals. We did hear that it's official that there'll be a mega site. Those are managed by the state, opening at Worcester State University sometime, they're estimating, in mid-February. And that will be available to vaccinate eligible individuals from across the Commonwealth, not just limited communities within the Commonwealth. And then there's a number of smaller locations that are popping up that are going to start offering vaccines to eligible individuals also. So I think the Wegmans in Northborough, the Hannaford in Uxbridge, Market 32 in Sutton, and there's some others along the way. And I know that UMass is opening up at least one site, I think at least the Mercantile area in Worcester, for their patients that are eligible. And pretty much the way they're having it is they've identified the list of the first kind of group that they're going to approach for vaccines, and they'll reach out to their patients when it's time to schedule the appointment. Because I'm sure they too are receiving all sorts of questions about when various patients can get the vaccine. The initial rollout of the CVS and Walgreens across the country, those first groups of those, Grafton, our CVS in North Grafton is one of the first CVS locations in Massachusetts that'll be offering the vaccine. They, like the rest of the area, will be following the mass phased approach for eligibility, so you have to be eligible. And you require an appointment. They will not do any vaccines that are walk-ins. The latest estimate I heard was that starting tomorrow, as long as their vaccine supply was coming in on time, they'll open up the slots to start booking appointments, and that the first appointments would be starting on the 11th of February. Obviously, distribution dependent. One thing to call out is, although it is great that the CVS in North Grafton is one of the first ones, those locations, whether they be the Walgreens, the CVSs, the Wegmans, they're not limited to just certain communities. So anyone across the Commonwealth can go to, say, the CVS in North Grafton. It's not just limited to a host of, residents who live and work within, 50 miles of Grafton, for example. So you could see that there are people coming from across the Commonwealth because they were lucky enough to get an appointment, say, in North Grafton, for example. The next closest CVS on that initial list is somewhere in Worcester. They didn't specify on the chart where in Worcester that next one was. But more of those locations will be coming out from the CVS and the Walgreens sides. So that's obviously also very positive. In terms of Grafton specifically, there's still more discussions that are continuing around the feasibility of conducting vaccine clinics for seniors in Grafton, because the biggest hiccup obviously could be us getting vaccine doses, and then obviously there's also the unknown timing. So all of that said, it makes it difficult to plan, communicate, schedule clinics when you don't know exactly when and if you can even get vaccine. So that's been the trickiest part for communities, is trying to figure that out and also serve our communities as best as possible. I did want to call out that the town has been advised that we don't post sign-up sheets for the public, because we've heard of confusion when people do in certain communities post those sign-up sheets. We did consider it. But we took all of the information available to us and guidance that we received. There's concerns that if you sign up on one of those sheets, some people are thinking they're kind of getting a spot in line for the vaccine, or they're getting actual appointments made for them. And neither of which are true. It's a way to typically get information. So you put your name out there, and then if and when vaccine clinics and information become available, you'll get notified. But it's not that you have an appointment scheduled for you just because you signed up to get more information. And with that being said, there were also concerns that people might sign up for these, sign-up sheets, and then they think, oh, well, I signed up with the town, so I'll get the vaccine from the town when it's available, and they could have missed out on getting it, say, from their primary care provider or from a different clinic or a CVS. And obviously we don't want people missing out on the opportunity if it's available elsewhere. Let's see, is there anything else? I think that was it kind of from the general side of things. I know, Dan, you've been kind of spearheading thinking about ways to potentially get clinics for at least seniors in the town housing communities that we have.
Right. Yeah, on Thursday's bi-weekly Zoom meeting, Ray Mead, who is our emergency management director, suggested that the MedStar, who's the ambulance company here in Grafton, might perhaps be able to provide sort of a mobile thing at the 3 community senior living communities. However, since then, Paul Olson, who's the manager of MedStar, said at this time they don't have the personnel and the staffing to take that on. However, I'm thinking on Wednesday we're going to hear a lot more on this call from the Alliance, and hopefully they have a plan to help us out. As I had mentioned on that particular Zoom, I was in touch with a couple folks from Sutton and also from Millbury about what they were thinking, and they're hoping to have a clinic more open to the public, depending on the phase, by the middle or late March, and with any luck with the Johnson & Johnson one-shot vaccine, which would be a lot easier logistically to deal with, So I think we're going to hear a lot more about it this Wednesday.
Any questions? Board members, Barbara? All right. Yep, Carter?
And,
Oops, sorry.
I do believe the news report about the Worcester College of Worcester University site, super site, said they were going to be using the Pfizer vaccine and not the Moderna vaccine. And I think it will be important for people not to get confused about which vaccine they're getting, particularly when they need two of the vaccines. So they'll presumably have to go to the same site and get the same product that they got with the first injection.
Agreed. Carter?
Thank you. One of the reasons that we've assigned William to try to be of some assistance to Nancy is to lighten her load a little bit and try to make sure we're using every opportunity to get out every news that we can. For instance, late today was the conversation of private primary care providers. My wife taking care of her 94-year-old mother who's not getting in a car to go to a clinic anywhere, kind of thing. The select board obviously had heard many things about this town was taking up sign-up sheets, and this town was doing this, and this town was doing that. So they've asked us to provide a little bit of a report tomorrow evening. We've tried to emphasize that it's important that the community not overpromise and underdeliver and fail, particularly given the supply of vaccines being not 100% consistent and reliable at this particular moment. So I'm trying to get a handle on, is it the board's intent, or is it still an evolving picture to rely upon many of these other major sites so that you can use those resources and try to maximize throughput and continue to look at a local clinic perhaps at some point in the future when it proves that the logistics might be something that you can carry out and be successful at? Is that a reasonable way to say it? Not a reasonable way to say it? What should we be putting forth?
Dan, I saw you unmuted.
Yeah, I think it's reasonable to say that we're hoping to provide vaccinations locally now, whether it's with another local town,
Right.
or ourselves, and but it kind of has to happen when the floodgates of the vaccine open, and the supply is reliable, and that second dose is reliable. That's still a little up in the air, so it's really hard to commit to a timetable. But
Right.
But Karen, if I could go into the next item on the EDS drill, do you mind?
Yeah, that's fine, because I mean, it
It's
is.
that we
kind of
did
a-
have a very successful emergency dispensing site drill on Friday, the 22nd, at the Grafton High School, and it was a drive-through one. And we had about a dozen leaders there, and Dr. Bill Muller was there, and Julie, and a number of other folks. And we did get the blessing, so to speak, or we passed muster with the Region 2 emergency planner, who is Jamie Terry, and she thought we have a good plan in place, and we also have a pretty good site there if it happens to be outdoors, which would be pretty tricky this month. And we also have a very robust membership of the MRC and CERT. In fact, just today I reached out to Barbara, who's here, and Pam and Kathy Cedarberg, and they all jumped at the opportunity to get trained in the organizing appointment organizer type of thing called PredBond. And there are 3 trainings this week, and I think they're each going to try to get an hour's worth of training on that, which again, which would take significant, well, at least some of the weight off of Nancy's plate in terms of trying to organize that and set up the, the whole plan of the second vaccine, if that's the case. Or again, it would be nice if it's one vaccine. So those things are kind of in the works, but there's really just nothing quite concrete at this time. We're just going to have to take it several weeks or a month at a time, I think.
Thank you.
Anything else related to vaccines, at least at this point? All right. Well, much more to come on that. Really hoping that the vaccine supply starts to get better, especially if they can get the J&J one out there into the market also, if it gets authorized. That'll help alleviate, from a logistics standpoint, being only one and also having better handling conditions. That will definitely help, because with the 2 doses, like Dan mentioned, you might get a group of doses for the first, but then you have to make sure you can actually get that second set of doses, because there is that timing based on it. And obviously you want to get, as Dr. Muller said, Pfizer and Pfizer, and not Pfizer and Moderna. They haven't done the studies yet to show, although hypothetically it should be fine potentially if you had one of each of, say, the 2 mRNA ones. No one really knows for sure at this point. So it all, when you're trying to plan a clinic or clinics, it's hard when there's so many unknowns around what you can actually get access to and when. All right. EDS drill, I'm assuming, Dan, there's no more on that than we already just talked about.
Nope, not really, except that we do in fact have an indoor drill as well. And that's been practiced each year for the past 3 or 4 years. It would be nice if folks don't have to drive to Gillette Stadium or whatever. So again, a lot of it's going to depend on the availability of the vaccine, I think.
All right. There's nothing else on that. Then I think the last topic for discussion was the Mask Up Grafton campaign. Dan, if you want to.
Sure. Nancy, are you able to, you can hear us. Can we hear you? Maybe not. Okay. So I'll try to convey what she and I have been, at the last meeting, the board asked us to sort of negotiate or work some things out with Sunshine Sign, and it's unfortunate that it's taken so long with everything else going on. But most recently, Nancy and I were both thinking that it may not be worth all that money at this juncture, at this point in time, when we might need some of that CARES Act money for some other things specifically related to, vaccinations. For instance, at the FEP meeting last week, they said vaccine might come, but you might have to purchase your own box of auxiliary equipment, which is the syringes and the swabs and the Band-Aids and masks and things. I don't know. I would think that they're shipped together, but there might be something that comes up that we're going to need some money from this CARES Act. So we were trying to scale it down. But Nancy had an idea just this afternoon that instead of going to the door signs for each of the businesses, which are interchangeable, things are changing so fast, we might be trying to change them every few weeks with information. And it's logistically tricky to get around to everybody and to explain that program. But the sign that they do have that might be worth going from one, and then I thought two, but she said maybe three of the A-frame signs that have something very simple initially, a message on either side at three, coming into town from a couple areas, and maybe on the common or whatever. And basically, initially, it would be, mask up and wash your hands and distance yourself or whatever, something simple like that. But again, we'd be able to, on those three signs, get a message out if there is in fact a local vaccination clinic, for instance, or some other message that we want to get out. And plus those signs, it's sort of a sleeve type of sign where you can insert a message, and those would be useful again for MRC or CERT programs. Or anyway, I don't know what other people think about that, but basically that we were cutting it down from a $5,000 expenditure for a whole bunch of signs down to about 3,000. But I think the three, I don't have the quote in front of me, but the three A-frame signs would be closer to $1,000 or a little less, I believe. So any comments on those ideas before we go forward with it?
Do you remember how big the A-frame signs were?
They are 3.5 feet by 2 or 2.5 feet. They're not huge. And then Nancy was in touch with the woman that has been working most recently from Sunshine about how they're anchored and what they're made out of. So we're still trying to get some of that information.
I would just be worried if we placed them coming into town, if people would be able to see them as they're driving. They're going 30, 40 miles an hour. The
Yeah.
sign would have to be big enough that they could see it. But I guess if the wording was just mask up, you can make that pretty large on a 2x3.
Right, and that might make more sense to put them like at the municipal building or someplace where there is traffic, walking traffic. That's a good point, Austin.
I like the A-frame idea though.
And actually, I just got a text from Nancy, and she said she's speaking directly to Sunshine tomorrow. So I guess we'll have more to come. But Bill, what do you think about that?
I think it's certainly worthy of consideration. I mean, I think people are familiar with Grafton know that there are a few critical points where, information can be placed, certainly at the bottom of the hill where 122 and 140 part, probably also when you're coming by Wyman Gordon and a couple other places. I think it might be more than three, though. It might be more like, I don't know, 5 or 6. You get one near Northbridge, and you get one in North Grafton, and one near Upton, and then one down at the bottom of the hill. You could probably strategically put them in places, the road to Millbury too. As it turns out, there aren't that many roads that come in and out of Grafton.
Right. Yeah.
And so
Yes.
I do think in the interest of frugality and getting the most for your effort, it's worthy of consideration. And I don't know that we actually know how receptive the businesses would be to put additional signs on their places of business, including, places that are corporate, kind of like the Cumberland Farms. I don't know, they probably have some corporate rule about what they can post and things like
Right.
that. So,
Right. It would take 6 months to get that decision, probably.
yeah, I mean, it certainly, I'm very much in favor of supporting a local business. The Sunshine sign has been very receptive, and it sounds like they're willing to work with us. I think if we do this, it might actually be 4 or 5 signs rather than 3, but I would certainly support it.
Okay, great. Yeah, again, Nancy's going to be speaking with them tomorrow, and we'll get back to you, but probably make a decision though, because time is going on in that range. But again, they'll have the flexibility of moving them if they have to, but also reusing them for other purposes. So, okay, thanks.
Right now, it'll be on top of a snowbank somewhere.
Right. Yeah.
We have to be mindful not to put them where a plow is going to just obliterate them
Destroy
potentially.
them, yeah.
Very good. Yeah.
Okay, thank you.
Yes, that's all we had for discussion topics. Don't know of any mail or correspondence. So that just leaves upcoming meetings. So we have March 8th, April 5th, May 10th, and June 7th. All right. So with that, oh, Dan.
Nancy did text that she doesn't have any more questions or.
I don't
But-
feel
but
bad. She's
those-
like, try unmuting me. I'm like, I tried. All right.
So those all look good to me. This is Dan Finn. I'd like to make a motion to adjourn the meeting.
Is there a second?
Austin Magnet, I'll second that motion to adjourn.
All right, and then roll call vote. Dan Finn,
Dan Finn, aye.
Austin Magnet,
Magnet, aye.
Bill Muller,
Bill Muller, aye.
Aaron Glazowski Govan, aye. Thank you, everyone.
Yep.